Max Healthcare and before helming this critical role at Care. Ladies and gentlemen, I'm talking about Mr. Vijay Sethi. It gives me immense pleasure to be introducing him and welcoming him on stage to address the gathering. Sir, अभी बस एक फिल्मों में join होना बाकी है आपको. So ladies and gentlemen, let's give him a big round of applause. This initiative was taken up. This whole concept has been Mr. Vijay's idea. So congratulations, sir, for putting such an amazing event, and the stage is all yours.
Thank you, Shilpa. I think in her little introduction, she's told how old I am. You know, I don't know how old I look though, but I think she's told my age also. My name is Vijay Sethi. I can only speak Hindi or English at the moment. My apologies if somebody, I can't speak Telugu so fluently yet. I've been just here for 1.5 years. Yes, this is not about me or anybody from the Care Hospital. It is everything about you all. And we actually thought when this idea came to my mind that why not we call some of our patients who have done well and have been treated and by our eminent doctors and consultants who are also here today, and get them here not as patients but as our guests, and have a little bit of an interaction to see and figure out how are they doing, and if there's anything that they want to share with us, and make them feel a little more informal, more engaging, and more social rather than just the patient-doctor relationship. I hope you have a nice evening here, and the whole objective is not to get you to kind of feel that you were a patient, but just to make you feel that how do we feel when we see you back so healthy and hearty when you come to such kind of a gathering. So that's the objective of this entire initiative, and I'm sure whatever you will take away from here will be more of memories, and if there's anything that anyone wants to share as part of their experience, most welcome to come on the stage. Thank you once again for being here. It is really, really very grateful for all of you. And from Care Banjara and Care Hospitals, I actually thank you for remembering us as a hospital, as our doctors, and thinking of us to come and get yourself treated and feel very good and confident that you have your trust with us and continue to do that with us. And have a nice evening. I'll hand over to Shilpa to take the further evening ahead, please. Thank you very much.
Thank you, sir. Well, today, Vijay garu cheppinattu, we have patients anakodu anukunnam memu, guests annam ani cheppi anukunnamu. So ikkada chaala mandi ma guests evarikaithe chaala long relationship undi with Care Hospital and Care team, vallandaru kuda vachunnaru, and eminent doctors kuda ee roju ikkadiki vichesaru. So వాళ్ళందరి గురించి చెప్పాలి అంటే ఇంకా మాటలు రావండి, బికాజ్ ఐ థింక్ దే ఆర్ ద రియల్ హీరోస్, ఆర్ డైలీ రియల్ హీరోస్. అంటే మనము ఫిలిమ్స్లో చూస్తాము చాలామంది హీరోలు గన్ను పట్టుకొని లేదా కత్తులు పట్టుకొని ఫైట్ చేసి జనాల్ని కాపాడుతూ ఉంటారు. అలా కాకుండా వీళ్ళు తమ మ్యాజికల్ హ్యాండ్స్తో, చేతులతో ఆపరేట్ చేసి సర్జరీ చేసి మనల్ని కాపాడతారు. సో అందుకనే అంటారు దేవుణ్ణి మనం చూడలేదు కానీ దేవుణ్ణి కలిసాము ఎలా అంటే డాక్టర్ రూపంలో. సో మరి ఈరోజు డాక్టర్స్ అందరినీ కూడా నేను ఇంట్రడ్యూస్ చేసే ముందు ఇక్కడ ఉన్నటువంటి పేషెంట్స్ అందరు కూడా ఒక్కసారి లేచి మా డాక్టర్స్ అందరి కోసం ఒక స్టాండింగ్ ఓవేషన్తో ఒకసారి గట్టిగా చప్పట్లు కొడితే దిస్ ఇస్ గోయింగ్ టు బీ రియలీ వండర్ఫుల్. టు ఆల్ ద డాక్టర్స్ హు ఆర్ ప్రెజెంట్ హియర్, యు ఆర్ అవర్ ప్రైడ్, sir. Thank you all the doctors for your care, for your patience, for your professionalism, and most importantly for touching our lives and making a difference. Thank you, ladies and gentlemen. Please be seated. Thank you. Well, indaka cheppanu that oka doctor tappu cheyadaniki ekkada veelledu antaru. So దీని గురించి నేను చాలామంది డాక్టర్స్తో ఎప్పుడు మాట్లాడదాం అనుకుంటాను కానీ ఏ ఇంటర్వ్యూలో నాకు అవకాశం దొరకలేదు. బట్ దిస్ ఐ థింక్ ఐఎమ్ గోయింగ్ టు యూటిలైజ్ దిస్ ఆపర్చునిటీ టు టాక్ టు దెమ్, interact with the doctors about their feelings, about their mental health too. Well, before I actually recognize them, call them on stage, I would like to mention a special thank you on behalf of Care Banjara and Care team to all the doctors. Dr. Vamsi Krishna, urologist, Dr. Vipin Goyal, surgical oncologist, Dr. Pratik Bhatnagar, cardiothoracic surgeon, Dr. Vishnu Swarup Reddy, ENT surgeon, Dr. Mohammad Abdul Naeem, liver transplant surgeon, Dr. Surya Prakash Rao, interventional cardiologist, Dr. G. Rama Subramaniam, cardiothoracic surgeon, Dr. Vikrant Reddy, nephrologist, Dr. Pavan Kumar Reddy, critical care specialist, Dr. Pradeep Burali, interventional radiologist, Dr. Sindura, gynecologist. So, Iroju, welcome Mr. Vamsi Krishna, Dr. Vamsi Krishna Garu, to please come up onto the dais. అమ్మయ్య అందరిలో గుర్తుపట్టింది మీరే సార్ నన్ను. థ్యాంక్ యూ. కాబట్టి మీ పేరు నేను ఫస్ట్ చదవలేదు, లిస్ట్లో మీ పేరు ఉంది కాబట్టి చదివాను. సో గుడ్ టు సీ యూ సార్, అండ్ వీఆర్ ఆల్ వెరీ ప్రౌడ్ ఆఫ్ యూ అండ్ ది సెల్ఫ్లెస్ సర్వీస్ దట్ ఆల్ యువర్ డాక్టర్ ఫ్రెటర్నిటీ హ్యాస్ బిన్ కాంట్రిబ్యూటింగ్. సో ఈరోజు ఈ ఒకేషన్లో మీ నుంచి 4 మాటలు వినాలనుకుంటున్నాం.
First of all, very good evening to all. So this is a first of its kind of an event which I am seeing being in practice for whatever a decade or more. So I'm first of all very thankful to all the patients whoever have accepted the request and attended this event, not as patients but our guests. And at the same time, on behalf of Care Hospitals, and I want to thank my team behind me, the whole admin team, the idea conceptualized by Mr. Vijay Sethi Garu to bring this event and put up this kind of program so that we also can interact with our patients more informally and share our experiences, how we went through them, all this, how we were there with them through their ordeal, and finally we are able to sit together here, relax, and then meet and greet. So I don't want to waste much further time. I have so many seniors and friends around. So thank you for giving me this opportunity to have a word. And I am a good fan of you, big fan of you.
Thank you so much. You made my day. Thank you, sir. Thank you so much. A very adoring and amazing doctor with us. ఆయనతో ఒకసారి మాట్లాడిన వెంటనే ఆయన ఎనర్జీ మనకు వచ్చేస్తూ ఉంటుంది అనమాట. He carries with himself that positive energy which is so contagious. Yes, ladies and gentlemen, I'm talking about Dr. Pratik Bhatnagar, cardiothoracic surgeon. Okasari gattiga chapalato. Let's welcome Dr. Bhatnagar on stage. Welcome, sir. This shows your personality. మేము ఎక్కడానికి అక్కడ స్టెప్స్ తీసుకున్నాము, ఆయన అక్కడి నుంచి ఒకే ఒక జంపులో ఎక్కారు. దీని గురించి అయినా ఒకసారి మనం చప్పట్లు కొట్టాల్సిందే. सर आपको तेलुगु आता है? जो आपने छलांग लगाया मैंने उसके बारे में बताया उनको कि हमको आने के लिए वी नीड स्टेप्स, लेकिन आपने जो छलांग लगाया वो बहुत बढ़िया था.
First of all, I have to say you talk as beautifully as you are as a person. Welcome everyone, and to all the patients here, my doctor colleagues, media persons, and especially I am thankful to the management for taking this opportunity. आज जो यहाँ पे फंक्शन हो रहा है, मैं हिंदी में ज़्यादा बोलने की कोशिश करूँगा, आई थिंक ज़्यादातर लोगों को समझ में आएगा. आज यहाँ पे जो फंक्शन हो रहा है, मैं 20 साल से हैदराबाद में एज अ डॉक्टर काम कर रहा हूँ, लेकिन मैंने आज तक किसी भी हॉस्पिटल को इस तरह का फंक्शन करते ऑर्गेनाइज नहीं देखा. सारे हॉस्पिटल्स पेशेंट्स को ट्रीट करते हैं, उनको घर भेज देते हैं, उसके बाद सिर्फ ओपीडी में पेशेंट्स के साथ इंटरेक्शन होता है, लेकिन पेशेंट के साथ बैठ के उनकी बात समझ के उनको सारे टाइम अपने साथ इन्वॉल्व करके ऐसा हमने नहीं देखा. सो आई एम थैंकफुल टू द मैनेजमेंट, डॉक्टर विजय सेठी, डॉक्टर राहुल मेडक्कर, एंड एवरीबडी इन द मैनेजमेंट, CEO जसदीप सिंह जी, एवरीबडी हैज़ बीन वेरी वेरी गुड इस प्लान के लिए, आइडिया के लिए. जहाँ तक हम डॉक्टर्स लोगों का सवाल है, हम लोगों का नॉट ओनली ये प्रोफेशन है, लेकिन डॉक्टर्स का पैशन होता है. नॉट ओनली हमारा, जितने भी हमारे यहाँ पे कोलीग्स बैठे हैं, ऑल ऑफ अस एंजॉय आवर वर्क, एंड ऑल ऑफ अस, हम लोग के लिए सबसे बड़ा हैप्पीनेस है हमारे पेशेंट्स के चेहरे पे स्माइल. और हम लोग कोई ऑपरेशन अगर करते हैं, पर्टिकुलरली कोई हाई रिस्क ऑपरेशन करते हैं, उसके बाद जब हम लोग पेशेंट से ऑपरेशन के बाद मिलते हैं, फैमिली को बताते हैं कि ऐसे ऐसे ऑपरेशन हुआ, तो जो सेटिस्फैक्शन उन लोगों के आइज़ में और फेस पे मिलता है, वो हम लोगों के लिए सबसे बड़ा प्राइज़ है। उसकी वैल्यू करोड़ों रुपए में भी नहीं आंकी जा सकती। सो दिस इज़ आवर प्राइज़। सो वी आर वेरी हैप्पी एंड थैंकफुल, एंड आई होप कि हम लोगों का जो पेशेंट्स के साथ जो रिश्ता है ऐसे ही आगे बना रहे, एंड ऑल ऑफ यू एंजॉय, हैव अ गुड टाइम and have a good evening. Thank you.
Thus, ladies and gentlemen, Dr. Vishnu Swaroop Reddy, ENT surgeon. May I welcome Dr. Vishnu Swaroop Reddy on stage, please. Welcome on stage, sir.
Good evening to all of you. This is, of course, as a doctor and patient, we can talk to the patients hours together and answer their questions and clarify their problems. First of all, I would like to thank Care Hospitals and the organization and everyone involved here. I thank all of them for the wonderful idea to meet this evening and sharing, some of our experiences, and that too with our patients who are treated by us. And I was not expecting to speak something on this evening. I think it's very satisfying for us to be here this evening, and particularly our patients expressing their happiness. That is the happiest thing in our profession. What more we want? I think that kind of evening is happening first of its kind by Care Hospitals, I heard. I wish you all a wonderful evening, and I hope you will all enjoy this evening. All the very best. Thanks for giving me the opportunity to say a few words.
I request Dr. Pradeep Burali, interventional radiologist, to please come up onto the dais to address the gathering. Dr. Pradeep. Welcome.
Thank you. Good evening, everyone. Actually, I am part of a big team of doctors here. So our HOD is Dr. P.C. Gupta. He is not here. So I am kind of representing him with other of my 3 colleagues who are here. I think చాలా విషయాలు ఆల్రెడీ నాకు ముందు మాట్లాడిన వాళ్ళు చెప్పారు. I think it's a great thing Care is organizing this, which is unique, and a lot of senior people have said it's never been done before. I have also not seen. So hopefully the guests, rather than the patients, we should not call them now, the guests, they have a good time, and hopefully we'll get opportunity to share their experiences, and we can hear from them not only the good thing, but what are the things which can be improved and make their experience even better. So hope all of you have a good evening, and really thank for this opportunity.
Thank you, Dr. Pradeep. The doctors kosam mem wait chestu unnamu, and they'll be here shortly. Before that, I think we have our guests. Ante indaka annaru patients annamata ekkada raakodu, because they have all come back with a happy face, so they are our guests tonight. Apologies, sir. Dr. Pavan Kumar Reddy.
అంటే ఇప్పుడు చెప్పాలంటే ఒక పద్ధతిలో అందరం పేషెంట్లే, పేషెంట్ కాని వాడు ఎవడు లేడు. డాక్టర్లు కూడా డిజీజ్కి కానీ జబ్బులు కానీ దే ఆర్ ఆల్సో ఎక్స్పీరియన్స్ దెమ్. ఇట్ వాజ్ సమ్ పార్ట్ ఆఫ్ లైఫ్. నాకు కూడా సర్జరీ అయింది, నేను కూడా కేర్లోనే సర్జరీ చేయించుకున్నాను. డాక్టర్ వంశీ హూజ్ మై జూనియర్ ఇన్ కాలేజ్ యాక్చువల్లీ, ఈ ఆపరేటెడ్ ఆన్ మీ. సో ఎంత వద్దనుకున్నా పోలీస్ స్టేషన్కి వెళ్ళొద్దు, డాక్టర్ దగ్గరికి వెళ్ళకూడదు, లాయర్ దగ్గరికి వెళ్ళకూడదు అనుకుంటాం. హాస్పిటల్కి అయితే వెళ్ళాల్సి వస్తుంది జీవితంలో. పుట్టుకలే హాస్పిటల్లో జరుగుతున్నాయి, చావు హాస్పిటల్ జరుగుతున్నప్పుడు హాస్పిటల్ అనేది మన జీవితంలో ఒక అంతర్భాగం. అది డాక్టర్ అనేది తప్పదు, ఒక్కొక్కసారి వెళ్ళాల్సి వస్తుంది. అయితే ఆ ఎక్స్పీరియన్స్ హౌ వీ హ్యాడ్ అనేది చిరస్థాయిగా ఉండిపోతుంది. ఎందుకంటే ఎప్పుడో కష్టాల్లో వెళ్తాం హాస్పిటల్కి, ఆ కష్టంలో మనల్ని ఎలా ఆదుకున్నారు, ఎలా చూసుకున్నారు అనేది ఇంపార్టెంట్. అది ఎవరైనా కావచ్చు, నేను కావచ్చు, రేపు మా పేరెంట్స్ కావచ్చు, లేకపోతే మా పిల్లలు కావచ్చు, అందరికీ అవసరాలు పడతాయి. తప్పనిసరి పరిస్థితుల్లో వెళ్ళాల్సి వస్తుంది, అందరం పేషెంట్స్ అవుతాం. బట్ ఆ సిచ్యువేషన్లో మనకు అండగా ఉండి అప్రాపరేట్గా కేర్ చేసుకుంటే అవి కొన్ని చిరస్మయంగా గుర్తుపెట్టుకుంటాం కొన్ని విషయాలు. ఎస్పెషల్లీ లైఫ్ అండ్ డెత్ సర్కమ్స్టాన్సెస్లో ఇంకొంచెం ఎక్కువగా ట్రస్ట్ కానీ ఇష్యూస్ కానీ ఉండాలి. ఇప్పుడున్న సిచ్యువేషన్లో లైఫ్ ఎక్స్పెక్టెన్సీ పెంచుతున్నాం కానీ క్వాలిటీ ఆఫ్ లైఫ్ పెంచలేకపోతున్నాం. బిగ్గెస్ట్ థింగ్ ఇస్ ప్రివెన్షన్ ఆస్పెక్ట్లో ఏమైనా చేయగలిగితే, రోగాల రుగ్మతలు మినిమైజ్ చేయగలిగితే we will all go a long way. I think as doctors, we will all look forward for that. Sometimes in a serious situation, మాదైతే నేను ఐసీయూ డాక్టర్ని, సో అన్ఫార్చునేట్లీ పేషెంట్స్ అంతా అదేదో సినిమాలు బ్రహ్మానందం చెప్తారు కదా, జీవితం సంగం రాకపోతే కానీ ఇది కలవలేదు. మేము ఎవరు రావద్దు అనుకుంటాం, అందరికీ చెప్తాం కలిసినప్పుడల్లా, మమ్మల్ని ఎప్పుడు కలవాలనుకోవద్దు, మీరు ఎప్పుడు రావద్దు కూడా మా దగ్గరికి అని. బట్ అలాంటి పరిస్థితులు వచ్చినప్పుడు కూడా we'll have to do our best to get everybody out and lead a healthy life. సో ఈ సిచ్యువేషన్ బేసికలీ ఆర్గనైజ్ చేశారు. మన వాళ్ళు చాలామంది వస్తుంటారు, చూస్తుంటాం, సిక్నెస్లో చూస్తాం. మళ్ళీ అదే పేషెంట్ మళ్ళీ వచ్చినప్పుడు కానీ ఆ పర్సన్ మళ్ళీ కనపడినప్పుడు అసలు మనమే గుర్తుపట్టాం. ఎందుకంటే హెల్తీగా ఉన్నప్పుడు డిఫరెంట్గా ఉంటారు, సిక్గా ఉన్నప్పుడు డిఫరెంట్గా ఉంటారు. వాళ్ళు మళ్ళీ వచ్చాక వాళ్ళని చూశాక చాలా ఆనందంగా ఉంటుంది. ఆ ఆనందాన్ని వెలకట్టలేము. మీరు ఎన్నిగానో ప్రొసీజర్స్ చేయండి, 100 ప్రొసీజర్స్ చేసిన కాళ్ళ దగ్గర వేసుకోగలుగుతాం, కానీ ఒక పేషెంట్ తిరిగి వచ్చాక చూసిన ఆ సాటిస్ఫాక్షన్ ఈజ్ కంప్లీట్లీ డిఫరెంట్. దట్ ఈస్ వాట్ వీఆర్ ఆల్ ఇన్ హియర్ ఫర్. దట్ ఈస్ వాట్ వీఆర్ యాక్చువల్లీ కీపింగ్ అస్ గోయింగ్ ఇన్ దిస్ ప్రొఫెషన్, నథింగ్ ఎల్స్. థ్యాంక్ యూ ఫర్ ఆల్ who have been a part of learning, who are part of teaching us and learning us grow, making us grow in that fashion. And your feedback డస్ రియలీ హెల్ప్. మీరు మీ ఇచ్చే ఫీడ్బ్యాక్ ఖచ్చితంగా హెల్ప్ చేస్తుంది హాస్పిటల్ ఇంప్రూవ్ చేయడానికి, సర్వీసులు ఇంప్రూవ్ చేయడానికి, వేరే పేషెంట్స్కి కానీ వేరే వచ్చే వాళ్ళకు ఆ ప్రాబ్లమ్స్ మళ్ళీ రాకుండా మనం చూసుకోవడానికి హెల్ప్ అవుతుంది. ఐ థింక్ దిస్ ఈజ్ అ స్మాల్ వండర్ఫుల్ గెస్చర్ ఫ్రమ్ ది అడ్మినిస్ట్రేషన్ సైడ్. We keep, it's better that we keep meeting informally also, so that you can express your anguish. కోపాలు తాపాలు ఉంటాయి ఒక్కొక్కసారి, అప్పుడు వచ్చినప్పుడు సరిగ్గా చూడలేదు, అప్పుడు వచ్చినప్పుడు బిల్లు ఎక్కువ వేశారని, ఇవన్నీ ఉంటాయి. అవన్నీ ఇన్ఫార్మల్గా కూడా మాట్లాడుకోవచ్చు, అడ్మినిస్ట్రేటర్తో మాట్లాడచ్చు, వాళ్ళకు కూడా తెలుస్తాయి విషయాలు ఏమన్నా ఉంటే. సో వాళ్ళు సర్దిద్దుకునే ప్రయత్నం చేస్తారు. సో దట్ ఈ హాస్పిటల్ ఆల్మోస్ట్ 25 years అయిపోయింది. హైదరాబాద్లో మీరు చూస్తే 2 పెద్ద హాస్పిటల్స్ అలా ఉన్నాయి, చైన్స్. నాట్ ఓన్లీ హైదరాబాద్, in the 2 states, 3 states, whatever South India lo, there are only 2 or 3 hospitals which have completed 25 years. అవి ఎందుకు నడుస్తున్నాయి, 25 years అయింది, ఎందుకు ఇన్ని సంవత్సరాలుగా ఉంటున్నాయి అంటే, దట్ ఈస్ బికాస్ ఆఫ్ ద ట్రస్ట్. పేషెంట్స్ కానీ ఎవరన్నా కానీ మళ్ళీ మళ్ళీ వస్తున్నారు, వాళ్ళకి తెలిసిన వాళ్ళని బంధువులను తీసుకొస్తున్నారు. దట్ ఈస్ బికాస్ ఆఫ్ ద టైమ్ దట్ వీ హ్యావ్ స్టూడ్. ఐ థింక్ ఇన్ దట్ ఫ్రంట్ కేర్ హ్యాస్ డన్ రియలీ వెల్. అండ్ ఇంకా చేయాలి, ఎక్స్పెక్టేషన్స్ పెరుగుతున్నాయి, డబ్బులకు బాగా ఖర్చు అవుతున్నాయి, కాస్ట్ పెరుగుతున్నాయి, బిల్డింగ్ కాస్ట్ పెరుగుతున్నాయి, మెడికల్ ఎక్స్పెన్సెస్ అవి పెరుగుతున్నాయి. అన్న సిచ్యువేషన్లో ఇంకా కొంచెం మా తాపత్రయం ఉంటుంది హాస్పిటల్ తరపు నుంచి. ఐఎమ్ లుకింగ్ ఫార్వర్డ్ టు బోత్ ఒక సింబయోటిక్ రిలేషన్షిప్, ఫీడ్బ్యాక్ అండ్ అట్ ద సేమ్ టైం అడ్మినిస్ట్రేషన్ సైడ్ నుంచి కూడా అందుకు అనుగుణంగా పేషెంట్ ఎక్స్పెక్టేషన్స్కి బీట్ అవ్వడానికి విల్ ఆల్ బి లుకింగ్ ఫార్వర్డ్ టు. థ్యాంక్ యూ.
రైటింగ్ స్క్రిప్ట్ సీరియస్లీ సార్, ఎందుకంటే బ్రహ్మానందం గారి డైలాగ్ కూడా మీరు గుర్తుపెట్టుకొని చెప్పారంటే, దిస్ షోస్ ద కూలెస్ట్ సైడ్ ఆఫ్ బీయింగ్ అ డాక్టర్. అంటే చాలా తక్కువ మంది, అంటే మనం డాక్టర్స్ అనగానే చాలా సీరియస్గా ఉంటారేమో అని అనుకుంటాం. అలా కాకుండా నవ్వుతూ ఒక సీరియస్ సిచ్యువేషన్ని కూడా చాలా క్యాజువల్ చేయడం, కూల్ చేయడం, ఇలాంటి డాక్టర్స్ కూడా ఉంటారు. ఒకసారి గట్టిగా లెట్స్ అప్లాడ్ ఫర్ డాక్టర్ పవన్. థ్యాంక్ యూ సార్ ఫర్ బీయింగ్ హియర్. వెల్, ఇప్పుడు చాలా చాలా బాగా తెలిసినటువంటి మిత్రుడు. ఎంత బిజీ అయిపోయారంటే మా ఫోన్ కూడా ఎత్తలేని అంత బిజీ అయిపోయారు. కానీ ఆయన గురించి చెప్పాలి అంటే ఒక చిన్న, ఐ థింక్ యూ షుడ్ బేర్ విత్ మీ ఫర్ 1 minute. యా, ఓకే. మా ఇండస్ట్రీలో చాలా స్ట్రగుల్స్ చేస్తూ ఉంటామండి. చూడ్డానికి చాలా గ్లామరస్గా ఉంటుంది. వి లుక్ బ్యూటిఫుల్, వీ హ్యావ్ అవర్ మేకప్, వీ గెట్ ద బెస్ట్ కాస్ట్యూమ్స్, వీఆర్ ఆన్ స్టేజ్, వీఆర్ అ పార్ట్ ఆఫ్ అ గ్లామర్ ఇండస్ట్రీ. బట్ దాని వెనకాల వీ హ్యావ్ అవర్ ఓన్ షేర్ ఆఫ్ స్ట్రగుల్స్. ఐదర్ వీ నీడ్ టు బిలాంగ్ టు అ క్యాంప్ ఆర్ వీ నీడ్ టు బీ siblings of a star, and that is where we get our success. But అలా కాకుండా ఇండస్ట్రీలో ఏ బ్యాక్ బోన్ లేకుండా తనంతట తనే వచ్చి ఒక సింగర్గా, ఒక యాక్టర్గా, ఒక మ్యూజిషియన్గా, ఒక ప్రొడ్యూసర్గా తన పేరుని నిలబెట్టుకుని బిగ్ బాస్లో వన్ ఆఫ్ ద స్ట్రాంగ్ కంటెస్టెంట్స్గా నిలబడి ఈరోజు మన తెలుగు సినిమా ఇండస్ట్రీలో ఏ బ్యాక్గ్రౌండ్ లేని ఒక స్టార్ ఎవరు అంటే మన మిస్టర్ నోయల్. So I think we all need to give him a big round of applause for accepting our invitation and being here. Thanks, Noel, for coming. And I was kidding. So Noel garu twaralone stage meedaki vachi and he's going to speak. But before that, may I welcome on stage Dr. Mohammad Abdul Naeem ji, liver transplant surgeon, to please join us on stage. Hearty welcome to you, sir. ఇవన్నీ వింటూ ఉంటే నిజంగా చాలా భయంగా ఉందండి. లివర్ ట్రాన్స్ప్లాంట్ సర్జన్, తర్వాత క్రిటికల్ కేర్ సర్జన్, ఇవన్నీ వింటూ ఉంటే మాకు బీపీ కొంచెం ఇదవుతూ ఉంటుంది సార్.
Good evening, everybody. I'm here to honor our patients and, more importantly, the donors who have given a gift of life to their loved ones. We live in an era where even blood donation, people are scared to donate their blood. So giving liver is a big thing. We have three patients and donors. We have got them today, where a mother has donated a liver to a child, young child, who was just about 5 months old when she got transplanted, and now she is about 1.5 years old. And then we have a son donating to the father and a wife donating liver to her husband. Normally, father is a hero to the children, but here we can see an example of the child being a hero to the father and donating liver. He himself is a software engineer, and despite knowing all the risk, he has put himself under the knife to make sure that his father is alive today and doing well. So I would like to honor them again and give this encouragement to people who want to donate, that they can not only save the life of their loved ones, and then they can also lead a normal life. So we have a software engineer here who has joined back to work within a month of his liver donation. Thank you again. Thank you. Thank you.
Thank you, sir. There's Subramaniam, cardiothoracic surgeon, to please join us on stage. Dr. G. Rama Subramaniam. Welcome on stage, sir.
Thank you. Thank you one and all for this evening, and then by inviting me to come talk about this, our experience, and then to meet our patients who operated, 3-4 patients we operated, and see some of these patients we operated is Impella, which is not done before in any place in this Southeast Asia. First time we did. And also we called one patient who had a dissection of the ascending aorta, who is pregnant. So that patient, we delivered the gynecologist delivered the baby, and then we did the dissection of the patient, and that patient is the greatest thing we can think of. It's a very, very rare, that type of thing. And then we do second time operations, third time operations. So those patients are also we called, and then if they are successful after operation and they survive, we feel very happy. And as a cardiothoracic surgeon, I completed almost near to 30 years of my cardiothoracic surgery, and then I operated on many patients, and then I felt if the patient survives, we feel very happy. So patient and attenders also should take this way rather than against doctors or something like that. So I thank administration and for giving this opportunity, and thank you one and all, and enjoy the evening.
ఇనిషియేటివ్ ద్వారా ఇలాంటి కార్యక్రమాలు, ఇలాంటి యాక్టివిటీస్ కూడా మనం చేస్తున్నాము అని అందరికీ తెలియజేస్తున్నారు. ఐ థింక్ దట్స్ వండర్ఫుల్. సో లేడీస్ అండ్ జెంట్మెన్, లెట్ మీ ఇన్వైట్ అవర్ నెక్స్ట్ గెస్ట్ ఆన్ స్టేజ్, డాక్టర్ విపిన్ గోయల్, సర్జికల్ ఆన్కాలజిస్ట్. Dr. Vipin Goyal. सडनली मुझे लगा ऐसे कोई हीरो आ रहा है सर वहाँ से चलते हुए. I wanted the lights, otherwise our director say lights, action.
Good evening. Thank you for the nice introduction. I will not take much time. Start with a small story. 3 years before, when I had planned to move out of Indo-American Hospital, luckily I had 5 hospitals options. So there were offers in my hand, 5 hospital. Then why I choose Care Hospital? The thing which I keep in center when I'm treating a patient is patient care, nothing else. Don't worry about anything, just patient care. Think what you can do the best for the patient. Don't think anything else. Money, everything is secondary. What best you can do. In that, I feel Care Hospital stands first. Denying 4 other options, I will not name the other hospitals. I joined the Care Hospital and I am lucky I am working in an institute which cares for the patient. The day I feel the institute is not helping or I am not helping the patient will be my last day working day. So, to the juniors who are present here, be ethical, do patient-centric work, that will take you long. If you do unethical work, maybe short term it will help you, but in long term, definitely your ethical work is going to help. See, think what best you can do for the patient. Sitting in your OPD chair, think what best you can do and what extra you can do. Definitely you will do no harm and you will do good for the patient. You are lucky, means I am lucky and doctors are lucky to be in a profession which can clear the patient tears, give them life. There is no other profession which will give this satisfaction what I get. No profession money wise, maybe you will get more, but satisfaction wise, there is no other profession which will give you more satisfaction than being a doctor. And I thank all my patients for believing me and undergoing under knife under me, and hopefully I have done justified what they expected. Thank you.
Cancer survival patient. So I often keep meeting oncologists, इसीलिए मुझे ये बोलना पड़ा ये. So it was nice listening to hearing you, Dr. Vipin. Wishing you all the very best and wishing you many more years of service in Care Hospital without considering any other options. And now I think our eminent doctors who are present here, they've come up on stage and shared their love for their work and the passion with which they work. And we have guests joining us this evening. అంటే ఇందాక పేషెంట్స్ అనకూడదు అనుకుంటున్నాం కానీ పేషెంట్ ఒక సర్వైవల్ దాకా వచ్చినటువంటి అంటే ఏమో అయిపోతుంది అనుకుని సర్వైవల్ దాకా వచ్చి బయటికి చాలా సంతోషంగా వచ్చినటువంటి చాలామంది పేషెంట్స్ ఈరోజు మనతో పాటు ఉన్నారు. సో వాళ్ళ ఫీలింగ్స్ వాళ్ళ ఎమోషన్స్ని కూడా ఈరోజు మనతో పాటు వాళ్ళు షేర్ చేసుకోబోతున్నారు. సో లెట్ మీ వెల్కమ్ ఆన్ స్టేజ్ స్నేహ భట్నాగర్.
Hello, good evening one and all. Thank you for giving this opportunity. First of all, I would like to congratulate the entire care team who has come a milestone embarking in the medical health for 25 years, and many more success to the entire team. I'm here to share the experience which has, I can't say it is good or bad, but I would herewith like to share. I would first like to say thank you so much, Dr. Pratik Bhatnagar, sir. He is a life savior for many. Sir, thank you so much. My husband had a heart attack in April, and we had gone to one of the corporate hospitals in Hyderabad, which is very famous, and he was put a stunt there. So we thought everything is normal and he would recover fast. But within a span of 7 months, it was a failure. So when we went back to the same hospital, we were told that he will have to undergo a bypass surgery. And I was totally shocked. I didn't know, because when there was a stunt placed, how it could fail. So I did not had much trust there. So I started inquiring who could be the best person, who could be the best doctor who could operate the surgery for my husband. Of course, I would expect the best. And then, like they say, God leads us to the best path, which led me to Dr. Pratik Bhatnagar, sir. Okay, so, and then I came to know about Bima, and I was little inquisitive about what is Bima. Everybody calls it a open heart surgery or a bypass surgery. Then what is Bima? I was quite inquisitive. When I met sir, sir explained me he reassured, he built in the confidence. Only then my husband agreed for the surgery. So I was shocked when I saw him walking around in ICU just after 2 days of performing the surgery. So, sir, thank you once again for that. You have built the confidence. Otherwise, I don't think we could have taken such a big risk. So, undoubtedly, Pratik Bhatnagar, sir, is one of the top cardiac surgeons across India. So I would like to throw a bit light on what is Bima, which I could understand, and I'm also trying to spread awareness among my family members. Because even after my husband there were a couple of incidents which we have come across. What more can a patient expect after a big surgery? They will be in too much of a mental trauma. First thing, the surgery word itself leads to a mental trauma. Same thing was with us too. So when I came to know from the sir, when he explained in detail, it is just a line which is cut straight in the chest. No other cuts. You don't find any other cuts in hands, legs, nothing. And the beauty of Bima is nothing but it is long lasting, first thing. Second thing, cosmetically best. You can wear anything you like. And my husband is there, as handsome as ever there.
Sir, if you could please stand up, sir.
So this has been my experience with sir, and undoubtedly, I was very glad even recently when I came to know that India today has chosen sir as the best cardiac surgeon in South India. So here is my handsome husband with me. And all that credit I give it to sir, Pratik sir. Thank you with all the gratitude from my family members, my friend circle. I express all the gratitude. And I sincerely, from the bottom of my heart, I express all the gratitude to sir. And may God bless the skilled heart and skilled hands which sir has. He is a blessing to the humankind. I have come across many doctors. So for doctors like Munna Bhai MBBS, you are only a patient. But when I met sir, he has a selfless, caring, reassuring that what builds a confidence in the patient to take that risk. Family members are secondary for the patient. First is the doctor, what doctor performs on the patient. Okay, we are all secondary. The family members, what support they give, is all secondary. But first, the bonding between the doctor and the patient is what I found with Dr. Pratik sir. So, sir, you are very simple, yet you are very elegant. Thank you so much, sir.
Mr. Rupesh Bhatnagar. So here is Mr. and Mrs. Rupesh Bhatnagar celebrating life once again, ladies and gentlemen. And this wouldn't have been possible without the K team, without Dr. Pratik Bhatnagar. सर हमको समझ में आ गया यही बात करते रहते हैं घर में भी वो भी समझ में आ गया the whole time even if Mr. Rupesh wanted to talk माइक जाता नहीं था थोड़ा बात करा ही लेते हैं मैडम
मैं आप लोगों के सामने यहाँ पर ठहरा हूँ तो सिर्फ प्रतीक भटनागर साहब के वजह से हूँ उन्होंने मुझे एक लाइफ स्कैम दिए है मैं उनका बहुत बहुत धन्यवाद करता हूँ मैं अभी उसके आगे कुछ बोल नहीं सकता हूँ मुझे मेरे कन कोई शब्द नहीं है कुछ बोलने के बाद थैंक यू
आप स्टेज में हैं इसलिए बोल म्यूजिक डायरेक्टर प्रोड्यूसर हिमसेल्फ लेडीज एंड जेंटलमैन it gives me immense pleasure and happiness to introduce my friend my colleague from Telugu film industry Mr. Noel Shang on stage welcome Noel welcome so good to see you so our people have been waiting for you to hear from you
First of all, Shilpa, you're very, very dynamic. Thank you for all the sweet introduction about me and everybody else.
are you guys comfortable in Telugu, Hindi, or English? So yeah, to run a nice program, it takes a very, very good anchor, and you are actually doing a great, great job, Shilpa. Guys, can we please listen for her? And great job, Shilpa. Awesome. Thank you for the sweet introduction. I'm here on behalf of all the patients who wanted to thank their doctors, because just now our hero, Dr. Garu, I forgot his name. But yeah, actually, you are beyond comparison, beyond profession, beyond money. You guys are just amazing. What you guys do is just, it fills our hearts. We are in a field where we can just entertain people for maybe a day, or, whenever they watch us, we can entertain them, we can make them feel happy. But what you guys do, you guys make a family happy forever. And they are, see, just now you heard her praise another man, and that can never happen in any other profession without the husband feeling jealous. They are so thankful. It's because of what you guys have in your hands. So I am here on behalf of all the patients who have so much to say to you, but they are falling short of words. When Shara told me that this is a doctor's meet with the patients, there's going to be an interaction, I wanted to come, because you guys might be knowing I've been to Big Boss, so I have come out in between because of my health issues. So what happened post-COVID, I have been into few complications. So my doctor helped me. If there was no doctor in my life, I don't know what would have happened to me today. So I am very, very thankful for all the doctors, all the service. That is why only this field is called the field of service. So thank you all, thank you one and all for everything that you are doing. You guys have magic in your hands, and no matter what, no matter how many words we try to put into it, it's always very, very less for the job you guys do. And I wanted to also talk about the management, all the people in care. Actually, the word care starts right from the compound you enter. All the people over there, ఒక డాక్టర్ దగ్గరికి వెళ్ళాలి అంటే డాక్టర్ దగ్గరికి వెళ్తే మంచి జరుగుతుందో అందరికీ తెలుసు, కానీ ఆయన వరకు వెళ్ళే లోపు చాలామంది ఉంటారు మధ్యలో. వాళ్ళు if they are not encouraging, if they don't have a good word of encouragement, if they are not kind to the patient, if they are not helpful, చాలామంది మధ్యలోనే చచ్చిపోతారండి, అంతవరకు కూడా రారు. So you have a great team, guys. Actually, Care has a great team, great management, and you guys should be very, very proud of the infrastructure and everything you guys have for the service of humanity. And I'm very, very proud and thankful, and thank you for giving me this time. So I've come all the way just to say thank you on behalf of all the people who won't be able to talk today, because I can on behalf of them. I love you all. Thank you so much, doctors, and thank you for having me here. And Shilpa, కుమ్మేసిన నువ్వు, నేను నీ ఫోన్ ఎత్తకుండా ఎప్పుడు లేను. ఆల్ ది బెస్ట్. వన్ ర్యాపా, ఐ నో దట్ దిస్ ఇస్ దెన్. Yeah, I know. But they are pretty cool today. I could hear them. They are actually, yeah. I maybe in some time I'll again join back. I want to hear all the stories, because we learn every day. So yeah, just now I was talking to my friend on the way, actually liver transplantation gurinchi. So one of my friend, he actually వాళ్ళ నాన్న లివర్ పాడైపోతే he actually, I don't know what you call it, donating only, right? So he liver transplant అయ్యింది, and even that guy is very, very fine, and he's doing awesome today. So ఇవన్నీ వింటూ ఉంటే there's such an education. So I wanted to learn something today. That's why I'm part of this program today. So I'm eager to listen to all the stories and all the success stories, all the happy stories that people are going to share. And congratulations to all the people out here, and thank you for having me.
So thoughtful of you, Noel, to be here. It was wonderful. Actually, in fact, Big Boss lo మీ అందరికీ తెలుసు, Noel had some health issues, and because of which he had to come out. And we really felt bad, because ఒక potential candidate, ఒక potential contestant బయటికి రావడం అనేది we really felt bad, truly. But yeah, better days coming ahead. వెల్, డాక్టర్స్ గురించి మనం ఇంత మాట్లాడాము, మరి చాలామంది పేషెంట్స్ ఇక్కడ వచ్చి ఉన్నారు కాబట్టి ఐ థింక్ వీ షుడ్ గో అండ్ ఇంటరాక్ట్ విత్ దెమ్. వెల్కమ్ సార్ ఆన్ స్టేజ్.
So good evening to everybody. It's a nice evening. Heavy rain outside, but still heavy crowd inside. So we see patients one-to-one basis and talk to them, counsel them, do whatever best possible in a particular situation, hope for the best. That's what a doctor can do. But you see, there are always limitations which are not in our hand every time. So we need a lot of cooperation from the patient's point of view, their family, more important, their family. So that's why if you get a bad patient in terms of his disease, but a good patient in terms of his behavior and the patient's family, it's a wonderful combination of a good doctor, a bad disease, a good patient, a good family. So like that, I just had this type of meetings I never attended, but I appreciate this is a one-to-one transparent talk. This is nothing like, I don't think it's a business or marketing event or anything. Patients openly expressing their views, frankly, good or bad. It's not that praising somebody always. There are many things which you have to correct ourselves. So I always feel every time when we read, it's not just everybody, it's like a tailoring pant or shirt to somebody. We see patients, thousands. Maybe in 25 years I have done in thousands procedures. But every patient, every procedure, we have to calculate ourselves, the patient's status, and do meticulously. If one error means it's a life. I feel the family, as said, that family is very important. So I always used to tell my colleagues or students, whatever, you may get exhausted and one day particular that you have done so much work and treated many sick patients. You feel, what is this hell, I want to go. That time a very sick patient comes, maybe you extend your time by 2-3 minutes, intubate him, turn him around. The family may feel another 10 years happy. This is very, very important in a doctor's life, what I feel. This cannot happen in any other profession, that we have to understand and get into this job. So I got some patients who happen to treat, and maybe you want to interact with somebody like that, or it's a interaction? Yes, Dr. Reddy is there. I can say now he's a friend come well-wisher rather than a patient. Reddy Garu, you want to say anything? No, Dr. He is from the Jubilee Hills Club, and he happened to come to the hospital with a problem. So he was referred by one good physician, whom I also don't know. She told me that this particular problem can be tackled by very few people. You go there. That's what I understand from. And the moment he entered, whatever best possible, and always his wife is to come and counsel, and he takes the decisions very firm and believes a strong commitment. That's what point blank he says this, and that means the doctor also feels very happy. If I want to do a complex procedure, my mindset should be on the technical aspects, not going to the emotional things too much, then I will deviate. So that's what Reddy Garu helped me, to be frank, to do a very complex procedure in his case. By God's grace, he's doing well. I just to know what is his impressions.
Good evening to all. First of all, I'll thank the CARE for giving me this opportunity and to speak in front of my savior, the doctor, Surya Prakash Rao Garu. And really, my life is, saved by this doctor. I'm always indebted. So basically, I want to give my little background actually. My name is P.P. Reddy. I am retired from Indian multinational. That is what you regularly travel on this L&T. So I'm a teetotaler. I am a vegetarian. When I got this pain, after so many years, actually I'm now 71. I am 71 here. And of course, thanks to the doctor, maybe my more. Maybe 70. So, see, when I got the pain, I'm more anxious that why I got it. See, I'm a teetotaler. I'm a vegetarian. I don't have any such habits, and regularly I do exercises, and I go for a walking, and I maintain my health right from my youth days. So that was biggest, worry. So I had gone to the care clinic, Dr. Pramila, madam. So she actually, it's like a family physician. So when I went over there, then she immediately took, in fact, there are many patients over there, but immediately she gave me attention and ECG and all that. So she found immediately there is something, but I cannot interpret. But she said, let me call the, what is that called? The heart doctor. Where is that? That is in Srinagar colony. So when she came, then I had undergone the echo and TMT. Earlier I used to go for the TMT, I used to go for even 10 to 15 minutes. In fact, I wanted to go, but people used to say, stop. 10 to 15 minutes I used to go on a TMT. But this time I could not even go for a 2.5 minutes and I had a pain. So actually then of course immediately they gave me some medicines. Immediately said, you should go to the care hospital. So care, when I said care hospital, then my family members used to say, you are going to care? No, let's go to some other hospital. I said care, that's the kind of impression they had at that time. So no, Dr. Pramila has said, definitely there is some meaning in that. So, and also very good doctor, she was saying. So then I went. Immediately I had to mobilize everything and then I came. See, my impression when I just landed at the care, and that was really, I think all of you must know this. Right from the security, I found it so inviting, so friendly. I think it just changed totally. What I had seen care maybe about 10, 15 years ago when my father-in-law used to be coming regularly. In fact, he was earlier got operated in Breach Candy in Bombay because I lived in Bombay for 40 years in L&T. So I got him redo there in Breach Candy. See, doctors were very nice. That is why Ramakant Panda at that time. But the entire ecosystem was so unfriendly. Even to approach to the doctor was so difficult. Compared to that, when I just landed in a care, it was so inviting. Immediately, the security guy himself was saying, sir, what is the, I said, I wanted to see the doctor. Okay. Immediately he is directed to the doctor's office. In fact, he followed me. So, that is the kind of, immediately I said, what is this? Then immediately I saw the entire, cleanliness in the care was really, really good. You see, the entire, then I really formed, I think it has changed, care has changed. When I just again went to the doctor, I think doctor was, of course, immediately came. I think within 10, 15 minutes, I think you attended to me, sir. So, see, then I could really, after seeing the doctor, in fact, I had some kind of, I don't know what has happened to me because I am being a professional, I should not be so emotional. But I got emotional, I said I got connected immediately. I said, now here is the doctor who is going to at least find out, diagnose and then treat me. So that is how I got into that. Then afterwards, I think sir has given me, I think I immediately got admitted and then I went through that angiogram. I think angiogram, after the angiogram, I don't know the technicalities of medical technicalities, but then there was a long debate whether I should go for a stenting or for the open heart surgery. Open heart surgery, my people were, all my relatives, everyone pressing for. And of course, doctor said, yes, he can do the stenting, but then my relatives were saying, no, I think every other people are saying, then let us go for it. So then I had agreed. I think my medicines are also changed accordingly, everything. But what happened after 2 days, I think I have gone through the procedure, that is what you call open heart procedure. Then somehow I said no. I think somehow I said no, but my original decision was correct. I have a faith in the doctor because I have seen him and I could connect him with him. So though it must be a bit embarrassing for me to convey to the other doctor that no, I don't want to go for open heart, but I want to go for a stenting hole. But they took it very sportively. That is really the care. I think any other place, especially the place like Breach Candy, other place, they would have thrown me out. I said, you have wasted our time. But I think here is the the other doctors which were really very, very good. And I was not feeling anything when whatever is happening. I think it took almost more than 2 hours. I think the only pain I have got is my bladder was getting full. My bladder was getting full. So that is the only thing which I had. But of course I could clear it. So and afterwards. I think everything went off. I think it must be a very complicated thing. I think I must thank her, and always I am obliged. So that is what is the thing which has happened, and I am continue to. And one more thing, I think one more very good, one more very important thing is that our doctors shared his personal number. Whenever I can very easily connect. I know that I should not, see as a patient, I mean to all the patients here, just because the doctor has given a personal number, I think we should never disturb them because he is doing a great service to others, not only to you. Only if the care is for, I would say that, it's like in olden days we used to have family doctor, like we have, of course, my Dr. Pramila is like a family doctor. Same way, this hospitals, if they can become a family hospitals, that means the family should prefer, it's like a family doctors and family, earlier we used to have that system.
I wish you all the best. Long live. Thank you.
ఎమోషనల్గా మాట్లాడుతున్నారు అండ్ ఐఎమ్ ష్యూర్ దే గో త్రూ క్రిటికల్ కేర్ అనగానే ఈజ్ సో క్రిటికల్ వీ నో దాట్ అందుకనే ఎంత మంచి యాటిట్యూడ్తో ఎంత కూల్గా తింటున్నారు అంటే ఐ విష్ ఐ కుడ్ యాక్చువల్లీ క్యాప్చర్ దాట్ మూమెంట్ బట్ వీడియో అందరూ అక్కడ ఉన్నారు కాబట్టి ఐ కుడెంట్ సెండ్ దెమ్ త్రూ సో పవన్ గారు కెన్ ఐ టాక్ టు అండ్ ఐ हैव अ डांसर हियर है ना एक बार तालियां हो जाए तो दोनों स्टेज पे आ जाएंगे एक गाएगा और एक डांस करेगा व्हाट डू यू से but I think we don't have music today here so I really can't invite Dr. Pavan but if anybody is willing to sing then I think Dr. Garu మీరు చూస్తుంటే మాస్ మసాలా పాట కావాలి సార్ మీకు నాకు అలాగే అనిపిస్తోంది బ్రహ్మానందం డైలాగ్ చెప్పారంటే మీకు మాస్ పాటలు కావాల్సిందే సో డూ యూ ఆల్సో వాచ్
It's like, you're trading with somebody else's life. It's on stake. So you have to don different caps at different places.
So true, sir. Thank you so much. And I'd like to speak to Dr. पूरा experience था कैसे रहा वहाँ पे बोलना चाहें तो आ जाइए तेलुगु हिंदी आपको जो लैंग्वेज में बात करना है अक्कड़ नीचे अड़गेरू यहाँ पे बैठ के बात करूँ या वहाँ पे जाके बात करूँ बोले सर
भाई साहब मेरा नाम मोहम्मद ख्वाजा मोइनुद्दीन है मैं एक गवर्नमेंट एम्प्लॉय भाई तो मैं बहुत सालों से लीवर के बारे में बहुत परेशान फिरते रहा मैं 5-6 साल बहुत अस्पताल में ट्रीटमेंट करा लिया ये हैदराबाद में कारपोरेट अस्पताल में पीछे ही बहुत बार फिरा मैं बहुत डॉक्टर के पास गया मगर मेरे को कोई डॉक्टर के पास सेटिस्फेक्शन नहीं हो रहा फर्स्ट बात तो लास्ट में मैं बहुत आदमी से मालूम कर लिया तो केयर हॉस्पिटल में डॉक्टर नईम साहब बहुत अच्छा ऑपरेशन करते बहुत आदमी पास सुना मैं उसके बाद में मैं बहुत सर्च करें डॉक्टर साहब के पास से तो करीब 2000 के ऊपर लीवर ट्रांसप्लांट ऑपरेशन करे डॉक्टर साहब तो मैं ऑपरेशन तो लीवर ट्रांसप्लांट ऑपरेशन तो करा लिया माशाल्लाह साहब का अब गोल्डन हैंड क्या बोलना गोल्डन तो नहीं डायमंड हैंड साहब का
अरे वाह
गोल्डन हैंड नहीं डायमंड हैंड
అంటే మైక్ పట్టుకొని ఎలా చెప్తున్నారంటే గోల్డెన్ హ్యాండ్ చెప్పానంటే చంపేస్తా డైమండ్ హ్యాండ్ అని చెప్పండి అని
అయితే भाई साहब ये ट्रांसप्लांट करा तो मैं करा लिया मगर आजकल दुनिया में क्या है वो तो लीवर पेशेंट अब बहुत है फर्स्ट बात मगर लीवर डोनेट करने वाले नहीं है फर्स्ट क्या हो तो अब बहुत बड़े लखपतियाँ भी है करोड़पतियाँ भी है बहुत सारे आदमी हैं अब उनके फादर का लीवर अगर अच्छा कुछ खराब हो गया समझो भाई डॉक्टर साहब के पास आते भाई मैं आपको 10 लाख रुपए देता हूँ कोई देखो किसको देखो अरे कहाँ देखते भाई क्या देखते किसको तो गोली मारते नहीं कोई नहीं देते अपने फैमिली वाले को लीवर डोनेट करे तो उनको अच्छा रहता मगर कोई भी इंसान लीवर डोनेट करने का से आगे नहीं बढ़ता। लाखों रहते वालिद साहब का बाप की प्रॉपर्टी करोड़ों होना हमारे को, मगर बाप के लिए अपन लीवर नहीं दे सकते। अरे लीवर देना क्या है भाई, 3 महीने में फिर लीवर फिर आ जाता है नॉर्मल होने। बॉडी में वो एक ऑर्गन ही है बढ़ने वाला खाली लीवर। लीवर दे सकते, हर आदमी लीवर दे सकते। अब देखो मेरे को, मेरा बच्चा 22 साल की उम्र में लीवर दिया। मेरा बच्चा सॉफ्टवेयर इंजीनियर बेंगलुरु में पीडब्ल्यूसी कंपनी में काम करता। मेरा बच्चा देखो,
क्या नाम है सर?
मोहम्मद शरीफ।
मोहम्मद शरीफ
सॉफ्टवेयर इंजीनियर है मेरा बच्चा।
सबसे शरीफ यहाँ पे आ जाइए।
मेरे लिए लीवर डोनेट किया। अब मैं भी ड्यूटी कर रहा हूँ अल्हम्दुलिल्लाह, और अल्हम्दुलिल्लाह बोलते यानी गॉड इज ग्रेट बोले साहब। मेरा बच्चा भी काम कर लेगा। पर मैं बोलना क्या चाह रहा हूँ, मुझे स्टेज पे बहुत सारे लीवर पेशेंट रहते मगर लीवर डोनेट करने वाला नहीं रहता। और करोड़पति आदमी रहते मगर लीवर के वास्ते बहुत परेशान फिरते थे। जहाँ तक मेरे को तजुर्बा है, लीवर के पेशेंट का बहुत सारे लीवर डोनर नहीं तो गुजर लो मर जाता है। पर हिम्मत करना, अपने औलाद हम दो रिश्तेदार हम को हिम्मत करके दिए तो उन लोगों की कुछ नहीं होता। लीवर एक बॉडी में वो एक ऑर्गन है, सिर्फ बढ़ने वाला ऑर्गन बढ़ जाता। देखो अब मेरा बच्चा ही देखे ना, 22 साल 23 ईयर्स प्रेजेंट बीटेक होने तेरी नौकरी मिल गई मेरे बच्चे को बेंगलुरु में।
माइक सामने लगा।
हाँ, अब अच्छा नौकरी भी कर रहा, अच्छा है। लीवर देने में कुछ भी नहीं। अब मैं भी देखो लीवर ट्रांसप्लांट कैंडिडेट असल में।
Ladies and gentlemen, a proud father, you can see the pride when he talks, he's so proud of his son.
लीवर ट्रांसप्लांट करना डॉक्टर साहब के हाथ में खाली ये गए तो अब समझो अब आपकी लाइफ बढ़ गई समझना बस।
सर कौन से डॉक्टर के पास आपने इलाज कराया?
डॉक्टर मोहम्मद अब्दुल नईम साहब।
अच्छा,
हमारे क्या बोल रहा हूँ, हमारे अब भगवान के बाद डॉक्टर साहब ही समझो क्यों बोलते हमारी लाइफ बताए हमारी। अब डॉक्टर साहब को हम जिंदगी पूरी हम
फ्यूचर में जो लोग ये वीडियो या फिर जो यहाँ पे हैं, they get lot of inspiration from you.
Yeah, thank you for giving me this opportunity. So मेरे डैड तो सब बोल चुके हैं, अब बोलने कुछ है नहीं। फिर भी आई एम रियली थैंकफुल टू नईम सर एंड ऑल हिज टीम, द वे दे टुक केयर ऑफ अस। एंड शुरुआत से ही मतलब प्री सर्जरी, नॉट ओनली पोस्ट सर्जरी गए हम लोग को। आई एम फ्रॉम प्लेस वेयर वी डोंट नो एनीथिंग अबाउट लिवर ट्रांसप्लांटेशन एंड ऑल दिस स्टफ, बट
कौन से प्लेस से है आप?
हम लोग, मैं खम्मम डिस्ट्रिक्ट इलंदू से हूँ।
खम्मम डिस्ट्रिक्ट।
या हम हमारे वहाँ ये सब नहीं होता। हम ही ऐसे फर्स्ट पेशेंट है जहाँ ये सब देखना पड़ा हम लोग को। पर जैसे डॉक्टर के पास आया, डॉक्टर जैसा हम लोग को कॉन्फिडेंस दिए ना कि हम उन्हीं के कॉन्फिडेंस उन्हीं के दिए हुआ कॉन्फिडेंस से आगे बढ़े। और सर्जरी के अब तो होता है भाई, मतलब पेन तो होता है, पेन तो हर किसी को होता है, इतनी बड़ी सर्जरी तो होता है। पर मैं ये बोलना चाहता हूँ कि सर्जरी को छोड़ दो, एट द एंड ऑफ द डे ही इज माई डैड, ही टुक केयर ऑफ मी टिल नाउ एंड it's my opportunity to take care of himself, take care of him from now. So I really thank Naeem sir and his whole team. Not only Naeem sir, not only whole team, even his administration department, and also special thanks for Hyder Ali sir, who has been with us from beginning to the end until we discharge. And as my dad said, he's a man with diamond hands, and ma'am said all the doctors are heroes. Indeed, Naeem sir is a hero, at least for me. And thank you so much, Naeem sir. Thank you so much.
Thank you, Sharif, for your valuable inputs. सर आपका वो छलांग वाला चाहिए। That's the way. एक बार ताली हो जाए। I just love the spirit. And sir, the stage is all yours. I think the lyrics are ready. बोल रहे हैं मनी मन, अरे चुप बैठ, माइक तो दे।
थैंक यू वेरी मच शिल्पा जी। एंड कोई मैं प्रोफेशनल सिंगर नहीं हूँ, बस शौकिया काम करो हॉस्पिटल में, उसके बाद घर में जाके अपना मूड फ्रेश करने के लिए कुछ गुनगुना लो कभी कभी जब टाइम मिले। सो दिस सॉन्ग आई एम सिंगिंग फॉर ऑल द पेशेंट्स हियर, नॉट ओनली माइन बट ऑल पेशेंट्स ऑफ ऑल द डॉक्टर्स। कुछ दिन पहले गला खराब हुआ था, माफ़ी करिएगा। आई नो बहुत बोलना जाता है, एक टिपिकल सेंटेंस है, बट आप किसी तरह से उसको ले सकते हैं। किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार,
जीना इसी का नाम है, किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है। माना अपनी जेब से फकीर हैं, फिर भी यारों दिल के हम अमीर हैं। माना अपनी जेब से फकीर हैं, फिर भी यारों दिल के हम अमीर हैं। मिटे जो प्यार के लिए वो जिंदगी, जले बहार के लिए वो जिंदगी, किसी को हो न हो हमें तो एतबार, जीना इसी का नाम है। रिश्ता दिल से दिल के एतबार का, जिंदा है हम ही से नाम प्यार का। रिश्ता दिल से दिल के एतबार का, जिंदा है हम ही से नाम प्यार का। कि मर के भी किसी को याद आएंगे, किसी के आंसुओं में मुस्कुराएंगे, कहेगा फूल हर कली से बार बार, जीना इसी का नाम है। किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है। థ్యాంక్ యూ వెరీ మచ్.
వండర్ఫుల్ సార్. పర్వాలేదు సార్, ఒక మీరు మాకు ఇక్కడ బ్రహ్మానందమే, మీరు రావాలి. రండి సార్, పర్వాలేదు. ఆల్ రైట్, సో I can see many kids all over here. So if any kid could come up on stage and perform, we have some special gifts. So చాలా మంది పిల్లలు ఇక్కడ ఉన్నారు. So if any of you all want to come up on stage and do a small dance act or a mimicry or a dialogue, कोई गाना गाना चाहता है, तो I have some great gift. బాగా వాచ్ చేస్తూ ఉంటారు అనుకుంటాను తెలుగు సినిమాలు అవన్నీ. సో మీరు ఆపరేషన్ చేస్తూ చేస్తూ భట్నగర్ గారు రాగా అప్పుడప్పుడు జీనా ఈసీ కనం పాడుతూ ఉంటారా?
నుంచి బయటకు వచ్చేస్తాడు. సో ఆల్రెడీ ఐ థింక్ చిల్లపిల్లలు ఉన్నారు, చాలా లేట్ అయింది. సో ఐ జస్ట్ ఇంట్రడ్యూస్ మై గెస్ట్ హియర్. ఐ రిక్వెస్ట్ మై friend and colleague Dr. Mr. Suresh, who is my personal assistant, Swati and Narayana, to accompany Caroline Garu and Farhad Jahan and Rauf Khan Garu onto the stage, and request each one of them to spend only a minute, so that because so many people are waiting, so better expedite their experience, not to spend more time. I just wanted to have a fun-filled evening with you, sir. Please. So come Suresh and Swati also on stage. So it's only the face I am seeing. There are so many people behind me, so many other doctors, nursing staff, the admin who is always behind us, including the Dr. Rahul and his team, everybody. Please, all of us come onto the stage, please. So, बस आप 1 minute में आप if you can just share your experience.
My name is M. Rauf Khan, retired superintendent education team, belongs to Nirmal district. Good evening to all. Good evening to all. मेरे को क्या हो गया था बोले तो यूनल ब्लैडर में ट्यूमर हो गया. ट्यूमर होने की वजह से मैं इंडो अमेरिका गया, अपोलो गया, हैदराबाद किडनी गया, एशियन गया, कोई दवाखाने समझ में नहीं आए. आखिरी में केयर बन जा रहा हमारे वंशी साहब से, डॉक्टर साहब से मिले तो उन्होंने यूनल ब्लैडर को निकाल दिया. उसमें कैंसर था, ब्लैडर ही निकाल दिए, निकाल के थैली लगा दिए. और डॉक्टर वंशी साहब का मैं शुक्रगुजार हूँ. सब जगह इंक्वायरी करे तो उन लोग वही बोले कि आपकी यूनल ब्लैडर निकाल देना पड़ता है. और मैं ये पूछना चाह रहा हूँ डॉक्टर साहब से कि यूनल ब्लैडर निकालने के बाद लगा सकते हैं क्या?
To Dr. Vamshi, by Dr. Deepak from Care Hospitals, Gachibowli. I came to doctor with a PCN and I was being treated as an outpatient for a few months. And then after that, I was operated. After my surgery, it took 6 months, 6 hours. And the doctor doing surgery for so many hours, it gives a second lease of life to us. So after my surgery, I've seen the doctor. He was so tired. And then after that, I was admitted many times to ICUs and the hospital wards. So I have seen how the nurses were taking care of me. And even when I came to the outpatient department, soon as I come, the nurses and the nurse assistant and everybody were just taking care of us till the doctor came. And the doctor, when I saw the doctor, he always welcomed me with a smile. And then when I told him all my complaints, he patiently listened to all my complaints and gave me a reply to all of them. To speak about the doctors, I don't find words. He is a wonderful person. That was the first time actually I was coming to Care Hospital to see the doctor. And as many as patients were there, he was seeing them so patiently. And I thank and after my surgery, I was in the first I was in the ICU and then in the wards. And
thank you. I request now Mr. Kishore and Maitre and parents, please. Mr. and Mrs. Kishore also can join. And also,
Sir was the only one to respond
Avantika,
when I had actually asked, and you're here.
Avantika and children. And I request my team also to join. Dr. Shruti is here and Kavita. And my chief audiologist, Dr. Srinivas and Raju. Because it's all the teamwork, actually. So we have 3 guests of the evening. Mr. Kishore, I think we will start with Mr. Kishore. Mr. Kishore, I operated maybe 2 years ago, I think. I request him to say a few words and then we will hand it over to the other 2 children's parents.
Thank you so much, sir. Good evening, ladies and gentlemen. Andariki namaskaram andi. Salam. Firstly, a big thank you to all the doctors here. I think you all have done a yeoman service in the last 2 years, be it whichever department you belong to. I think you all have done a yeoman service to mankind. In the last 2 years, it's been pretty tough for everybody during the COVID times. And I'm sure people have had different ailments and they've all been visiting hospitals. So it was a great job done. Thank you so much from all of us who have been here. Second thing, Care Hospitals. I've heard a lot of them say that. I too want to repeat the same. All these doctors who are here today, I think they actually have shown care, synonymous of the name. I think the doctors have proved that there is a lot of care when patients come to them. Thank you so much once again. Okay, let me quickly give you a small introduction of what problem I had. I was working in the corporate sector. I was working in the telecom sector. After 28 years of having worked, I never realized that I had a problem short of hearing. Obviously, when you have a problem with your sight, you can immediately make it out. కళ్ళు కనపడకపోతే మీకు తొందరగా తెలిసిపోతుంది కళ్ళద్దాలు వాడాలి అని. కానీ చెవి వినపడకపోతే మనకు తెలియదు. ఎందుకంటే పక్కన వాళ్ళు మాట్లాడుతూ మనం వినిపించుకోం. రెండోది నాలాంటి వాడు మాట్లాడుతుంటే పక్క వాళ్ళు మాట్లాడేది వినిపించుకోను. అందువల్ల నాకు వినపడట్లేదు తెలియడానికి చాలా టైం పట్టింది. సో నేను వేరే డాక్టర్స్ దగ్గర వెళ్ళాను. 7 years I suffered with the problem. I was short of hearing అంటే లో డెసిబల్ సౌండ్స్ నాకు వినపడేది కదా. And I was slowly లూజింగ్ ది సెన్స్ ఆఫ్ హియరింగ్. సో ఆ టైంలో నేను డాక్టర్స్ దగ్గర వెళ్తే సర్జరీ చేస్తాము కానీ కొద్దిగా రిస్క్ ఇన్వాల్వ్ ఉంది అన్నారు. నాకు రిస్క్ అంటే భయం వేసి దెన్ ఐ వెంట్ టు డిఫరెంట్ డాక్టర్స్, హియరింగ్ ఎయిడ్స్ వాడమన్నారు, ఇన్విజిబుల్ హియరింగ్ ఎయిడ్స్ని. కానీ అప్పుడు ధైర్యం చేయలేదు 7 years. Then one fine day, a friend of mine who was a software engineer, he actually told me that I'm going to the hospital, I got operated in the eardrum, Mr. Shrikant. ఆయన అన్నారు, can you drive me down to the hospital because I can't drive అని చెప్పి. So he took me along. I didn't realize he was taking me to meet sir. Because నేను డాక్టర్ దగ్గర వెళ్ళట్లేదు, ENT సర్జన్ దగ్గర వెళ్ళట్లేదని తనకు తెలుసు. I think a big thanks to my friend, wherever he is now, because he introduced me to this great gentleman who's standing here. And తల్లి జన్మనిస్తుంది, కానీ I think these doctors are much more than that. Mother is next to God, but I think doctors are also next to God. Thank you so much to the doctors. And actually, I'm a Google doctor. And I have the privilege of saying that among so many professionals who are sitting here, I'm a Google doctor. ఏ ప్రాబ్లం వచ్చినా గూగుల్ చేసేవాడిని. సో ఈ పర్టిక్యులర్ సర్జరీ ఏదైతే ఉందో I've seen it close to 50-60 times in the 7 years that was there. ఎలా చేస్తారు, ఏం చేస్తారని. అందువల్ల సార్ దగ్గర యాక్చువల్లీ సర్జరీకి వెళ్ళినప్పుడు I was actually watching the surgery on the screen, సార్ చేస్తుంటే, just to check if sir is doing a great job or not, on a lighter note. But I'll tell you what, సార్ సర్జరీ చేసిన తర్వాత ఇట్స్ అ గ్రేట్ జాబ్ దట్ హీ డెడ్. కానీ ఒక ఎక్కడో చిన్న మనసులో సార్ అంటే అది ఒకటే అనిపించింది, సార్ మీరు చేసిన సర్జరీ వల్ల మా ఆవిడ ఏం మాట్లాడలేకపోయినా వినపడుస్తున్నది సార్. అంటే తను మాట్లాడకనే ఆ మనసులో ఏముందో వినపడుతుంది. ఐ మీన్ ఐఎమ్ ఏబుల్ టు హియర్ సో వెల్ దట్ मन में जो सोचती है वो भी सुनाई दे रहा है. So I think thank you so much for that too, sir, because you can easily figure out, whether she wants to buy something or not. And I slowly run away, patli gali se. So
husband ka. గుడ్ ఈవినింగ్ ఉన్నాను, ఏదో ప్రాబ్లం ఉంది, వినపడట్లేదండి, మీకు వినండి, డాక్టర్ దగ్గరికి వెళ్దామంటే ఆయన చాలా భయం అండి. ఎస్పెషల్లీ మీరు తిట్టేది వినిపించట్లేదు, అది మన ప్రాబ్లం. తిట్టే ఒకటి వినిపిస్తుంది, తిట్టుకున్నది కూడా వినిపిస్తుంది అనమాట. నేను చాలా ఆయన చూస్తే తెలిసిపోతుంది, డాక్టర్ దగ్గరికి వెళ్దాము అంటే నాకేం ప్రాబ్లం లేదు, నేను రాను అలా తెలియకుండానే ఆల్మోస్ట్ 2-3 years వెళ్ళిపోయామండి. తర్వాత ఒక డాక్టర్ దగ్గరికి వెళ్ళాక ఆయన హియరింగ్ ఎయిడ్ వాడండి చాలు అన్నారు. నేను అప్పుడు లేదు సర్జరీ చేయించేద్దాం అంటే ఆయనకు భయం జాస్తి. చెప్పాను కదా, గూగుల్ ఈయన ఏ సబ్జెక్ట్ కదిలిచ్చినా కూడా మీకు లాట్ ఆఫ్ ఇన్ఫర్మేషన్ వచ్చేస్తుందండి, అన్ని గూగుల్ సెర్చ్ చేసేస్తారు, చెప్తారు. నేను సర్జరీ చేయించుకోను అని అలా ఒక 5 years నెట్టారండి. అది ఎంత ప్రాబ్లం ఉంటుందంటే ఆ బ్యాటరీ అయిపోయిందంటే ఇంకా